My name is Tracy Cundiff. I'm a 7th semester nursing student. I'm here to perform tracheostomy care and suctioning for a patient. It is September 23rd of 2019, and this is Opal Pearl. So I've introduced myself to my patient. I want to identify her with 2 patient identifiers, her name and date of birth. She's alert and orientated ×3, which is excellent. I also want to come in and assess her, noting any tachycardia, if she's having difficulty breathing and oxygenating. She is probably tachypnic if she's having difficulty breathing. And she's labored to breathe. And then I want to take my stethoscope and listen to her lung sounds, see if she has any advantageous lung sounds, rhonchi, rales, crackles, if she's wheezing, just to assess whether or not she really needs to be suctioned, and she does. Miss Opal has had a trach for quite a while now, so she's familiar with the procedure of suctioning and trach care, but if you had a patient that had a new tracheostomy, you want to explain those to them so that they can consent to the procedure being done. She is in high Fowler's, which is where we want her to be with a tracheostomy and performing trach care so she doesn't aspirate and to promote good lung health. I'm going to raise her bed up to a working height for me. Provide patient privacy, so I would pull this curtain behind me for her. I'm not going to because my suction and oxygen are back there. For the sake of the video, we're going to leave it open. I want to hyperoxygenate Miss Opal, since I am going to be taking her oxygen off, and turn my suction on between 80 and 120, staying on the lower end if her secretions are thin and minimal. If her secretions are difficult to get out or thick and copious, you can turn that suction up to aid in removal. Use your best judgment. You don't want to traumatize your patient's airway. So once we're ready to begin, I'm going to go ahead and drape Miss Opal with a towel to keep her as clean as possible during this procedure. Perform your hand hygiene. You can go ahead and open your sterile kit. I like to make sure that my patient has a good way to communicate with me during the procedure, because if anytime she has pain or she needs a break or she feels distressed, she can raise her left hand, let me know that. We can stop, give her a break, and then try again. And Miss Opal knows that really well. So I would take my sterile gloves and open them, opening the outside package away from me, pulling these out. Mind your 1-inch border and open your gloves up. I did bump the outside of my container there, but I did not contaminate anything in the sterile field. And my hands were not sterile at the time, so it should be fine. So you want to don your non-sterile hand first. Or I'm sorry, your non-dominant hand first. Excuse my language there. And then don your dominant hand. Throw your packaging away. Careful not to contaminate your gloves while you're doing that. Those sterile gloves would be in another package, so I did not contaminate them either. Pull out your cup for normal saline. You should have a cup of sterile normal saline in your kit. So go ahead and pour that in. And throw that container away. You also have a suction catheter in your kit, so take that out of its packaging. And I'm going to wrap that around my hand to gain control of that and let Ms. Opal know we're going to get ready to rock and roll. Go ahead and contaminate your hand and detach your suction. I'm also going to take this contaminated hand and remove her oxygen so we can have access to her trach. Test your suction. Lube the tip of that catheter up. Make sure that it's all working. And then we're going to go down. So we're going to go down without suction. So you meet resistance. And then back up with intermittent suctioning and catheter rotation to manipulate those secretions so that they come loose. And then give her a break. She needs a break and needs to be reoxygenated. You can take your contaminated hand, pull that oxygen back down until her stats improve. And then go back again to suction her, clear out your tubing. All right, we're going to go again. So you want to go down without suction until you meet resistance. And back up with intermittent suctioning and catheter rotation. And then you can clear your tubing out again. You want to do this until her lungs and breathing improve. Her lung sounds and breathing improve. And they have. So I'm not going to insert my catheter anymore for Ms. Opal. Go ahead and wrap this up in your glove. I'm going to pull her V-sponge here with my hand. And I'm going to take these gloves off, making sure that those are inside my gloves. And throw that away. You can take and turn her suction off at this point in time. Throw away these supplies that you no longer need. And pull her mask back down and reoxygenate her while you set up your next field if you need to. Some patients do fine without. And then re-clean your hands. Hand hygiene. It's very important. And we're going to don a new pair of sterile gloves. So again, these are in a package. Open the package up. Pull these out. But I forgot to open my trach kit first. So I would throw these away. I've already touched them. I'm afraid they're contaminated. So I would throw them away, get a new set. So go ahead. I would go get a new set of these. You need to open this trach kit first. So I'm going to go ahead and perform hand hygiene again. And then open your trach kit first. My apologies. Open this trach kit away from you. Now we should don our sterile gloves. So pull your new package. Open away from you. Pull these out. That glove did not touch the outside of my package. It should still be sterile. I know you saw that flop back down. It did not touch any packaging other than the inner packaging where it was already sitting. I want to mind my borders here. So again, don your non-dominant hand first. Dominant hand second. Throw this trash away. Make sure you don't contaminate your hand in that process either. And you can begin setting up your sterile field. So pull your drape. Mind your 1-inch border on this as well. You don't want to touch it with anything other than your sterile gloves. And set up your sterile field any way that you like for it to be, minding the fact that that outer border is considered non-sterile. These trays come with an extra tray for soaking, so I'm going to pull that out. And hydrogen peroxide, which I would open, dump into this container that I intend to clean in, throw that away. Comes with sterile normal saline, which I'm going to divide half and half between my hydrogen peroxide solution and then some to soak that cannula in once it's cleaned. Throw that away. So then we can get started. I need to contaminate one hand. So I'm going to pull her oxygen off. Again, if you need to reoxygenate her at any point in time, if she becomes distressed, you can do that. And then go get a new pair of sterile gloves. Don and doff as needed and continue your procedure here. So this dirty cannula needs to go into your hydrogen chloride chloride solution. Soak to remove any secretions. You can take this sterile brush that you have and you want to soak that in your sterile normal saline with your clean hand, sterile hand. And then pick this up to brush. And then I'm going to soak that in normal saline to soak off all that hydrogen peroxide. So soak that. Tap this cannula off. Get all the excess water off. Not water, saline, excuse me. All the extra liquid off, so you don't introduce that into your patient's airway. Reinsert with your sterile hand and make sure that it's secured in place. And it is. And then I want to clean, inspect and clean her incision site. You can do that by taking these sterile 4x4s, dipping them in your normal saline, the sterile normal saline, and you want to clean off her phalanges, clean off around her incision site, clean off anything that has secretions on it. So I would clean all of this here, making sure that I toss and get anew with each section that I'm cleaning. So clean everything off, get new, soak, clean, and throw as you go along. You can use Q-tips for that too if you have anything that's pesky to get to, needs to be cleaned off with Q-tips. And then make sure that you dry her skin before you go on to the next step. So dry her skin off, dry the phalange off, make sure everything is good and dry before you change your trach ties out, so that you don't have an issue with your patient and skin breakdown or bacterial growth in that around that wet stoma. So she's good and dry. I'm going to go ahead and change her trach ties out. If I had an assistant to help me do this, you could have them hold your phalanges in place for you, which makes this a little easier to move your patient up and down as needed. I don't have one, so me and Opal are just going to do this. She can lift her own head, so we should be able to do this staying as clean as possible for her. So I'd have Opal lift her head for me, and we thread these new trach ties behind her and put them on for her. Again, try to stay as clean as you possibly can while doing this for your patient. Okay, so I pulled her new trach ties through and tighten them down. You want to make sure that you have a finger breadth or two that you can put between her trach ties and make sure you're not cutting off her airway or circulation. And then you can remove these old ties from her. Lift your head for me, Opal. Remove these. And then I would take these, and I would probably also roll them up in my glove. Take these gloves off. So doff these, and then don a new pair of sterile gloves at this point in time, performing hand hygiene between gloves, so that you can insert a new V-sponge for her. So sterile again, I would get my V-sponge out of my kit here with a Q-tip. That's how I like it. You could also use sterile clamps to help insert these V-sponges, but just stay as clean or as sterile as you possibly can doing this for your patient. So we're going to go up under the trach tie collar here, and then wrap this again, and I go up under the other side of her trach collar. I'm going to contaminate my hand pretty good here and pull this through here, or tuck this, tuck Okay. And then I would take my cleanest hand that I have and pull these sponges up so that they're flush with the foliage and tubing. I'm going to put our oxygen back on here. So then you can take these gloves off. I need to clean up my area here, clean up my mess. I would want to lower Miss Opal back down to earth. Make sure she's got a call light in reach and her personal belongings in reach. And then you want to go document your assessment. You want to document the amount and characteristics of the secretions that you got out. And then that you changed her trach dressing and the date and time, obviously, that you changed that. And that should be all. Thank you.